But at any given moment, 1 in 7 of us needs treatment for mental illnesses, depression being by far the most common, especially for women. With World Mental Health Day coming up this weekend, campaigners are focusing on how to improve services and remove the stigma of having a mental illness. Our reporter Julie Etchingham is in Middlesbrough.
Good morning from the Rosedale Centre, which is actually part of St Luke's Hospital, but designed to be as little like an institution as possible. It operates as a daycare centre, smoothing people's way from hospital into the community. We'll be having a look inside in a moment, but first a quick snapshot of the state of our nation's mental health. According to the Office for National Statistics, at any given time, 1 in 7 of us is experiencing mental health problems. Depression is the most common, affecting 1 in 10, around 5 million people in the UK. Women are more likely to suffer than men. Between the ages of 20 and 54, 20% of women will suffer significant mental health problems, compared to 12% of men, but that figure is reportedly rising. Social factors also contribute. Unemployment and being a single parent put people at considerably higher risk. The percentage of people suffering serious mental health problems is small. The advent of care in the community in the 1980s has led to a halving of the number of psychiatric beds in hospitals. The government claims its review of the mental health services is a direct response to concerns over those patients who may have fallen through the care net. Well, you join us now in the kitchen area of the unit, where people are encouraged to come and cook their own meals and chat with people with similar problems. And we're joined now this morning by Nick McCreaton, who's suffered mental problems and still continues to suffer them. Tell us a bit about your condition, first of all, Nick.
Well, I am a mental health service user and I suffer with manic depression.
What does that actually mean?
The clinical term for it is bipolar affective disorder. It's mood swings, highs and lows. The highs I find are impossible to cope with, and that's when I need support. The lows, I've managed to develop a coping mechanism, and that's positive thinking and positive attitude.
Now, you've had treatment over the last 10 years. This unit just opened in May. What's your impression of it? What difference would it have made to you?
Had it been, when I was last in hospital in 1993, had it been available then, I probably wouldn't have been hospitalised. I think it's wonderful.
You actually work as part of an advocacy project, helping other people with mental health problems. What sort of impressions have they had, those people that you've encouraged to come here?
The impressions that they've had is that they would have cracked up without something like this. And I think that that says it all. There are flaws in the care in the community system, and our South Tees Community Mental Health NHS Trust have recognised those flaws and are doing something positive about it, i.e. the Rosedale unit.
Well, that's good to hear from you. Thanks for joining us this morning, Nick. Well, we'll just move out of the kitchen area here and into the dining area, which has been decorated beautifully, and also used for a good socialising area, I think. Morning to Maria Blades, who's a charge nurse here, and also to Nigel Maguire, who's Mental Health Director. What do you try and achieve with the people that come and use this centre? Because it's open all day for people, isn't it?
It's open 7 days a week, 365 days a year, so we're actually open for them to come and utilise and get treatment, but they can go home again on an evening. They don't have to stay in hospital to get the treatment that they need.
And you help people with a full range of illnesses?
The full range: schizophrenia, manic depression, anxiety, all sorts of mental health problems.
Nigel Maguire, is this seen as the sort of way to bridge the gap now between hospital treatment and care in the community?
I think it's certainly one of the ways. I think we have, over the last couple of years, been developing a number of initiatives to bridge that gap. And certainly this is a key part in that initiative. And what it means is we can avoid people having to be admitted into hospital. The other initiatives we've developed with our partners at Tees Health and Social Services have been the Crisis Intervention Team. That's whereby we have staff on standby 7 days a week that can respond to people in the community who have a crisis in the middle of the night or at weekends, for example.
What sort of reactions do you get from the people who use this centre, though, Mary? Because you're obviously coping with a full range of problems.
The reactions, I mean, a lot of people who have actually been in hospital over the years for treatment have now been using this service, and the benefits for them is that it doesn't disrupt their normal functioning. You know, they can carry on with their normal day-to-day living, which decreases some of the stress levels that hospital can actually bring to them.
So just to sum up then, basically, this is the positive step forward in the future of mental health care, do you think?
I think it is a very positive step forward. I think we've been fortunate in the last couple of years to see significant resources come to Teesside, and for Tees Health in particular, to identify those resources to help start bridging that gap between the community care and the hospital care that has been very much the traditional base of mental health services.
Thanks very much to both of you for joining us this morning, and now it's back to the studio.
Thanks very much indeed, Julie. Now, there aren't many subjects that we shy away from on this programme, and I think our next subject proves that nicely.